Time, and I call the member for Forrest.
Thank you, Deputy Speaker. I'm pleased to speak on this National Health Amendment Bill because in part it reflects on the importance of the stockholding requirements. And we've seen severe medicine shortages that are occurring under the Labor government's watch. The recent shortage of saline IV fluids in Australia has posed a serious risk to a lot of our healthcare system. Saline IV bags are absolutely critical to the emergency healthcare provided to patients in Australian hospitals, but doctors around in every hospital around our nation have been told to ration the amount they use for patients. This is not okay. The government's been aware of this, and Minister Gallagher admitted that the government had been aware of this impending shortage for over a year. So this is a real problem in Australia. The government's had more than 12 months' notice of this impending shortage, but no other country has had these same issues. But the problems in rural and regional areas where we live and work is even worse. I spoke to Rowan Lowe, who's not only a pharmacist in Donnybrook, a small regional community in my electorate, but he's also the National Pharmacist of the Year for 2024. And he wanted to talk I asked him about the shortages in rural and regional, and he said these are impacting, of course, on regional patients. These are Rowan's own words. And he said one of the biggest experience that we still experience on a weekly basis is that prescribers are not communicated with medication shortages and then send the patient off with a prescription that they're unable to fill. The pharmacy then has to reach out to the prescriber, the patient has to wait longer for their medication, and if the prescriber does not get back to us, that's their pharmacy, in time, the wait time can be extended due to the order cut-off times. He said, "We had an example last week of a patient being discharged from Busselton Hospital with critical pain medication post-surgery. The prescriber was contacted 3 times and did not call back. The patient was in pain for 24 hours until myself, as the pharmacist, went directly to the local GP clinic and used my relationship with the GP to source some alternative pain medication for the patient. There needs to be more up-to-date resource for all prescribers to access that shows the stock availability in their regional areas." He went on to say local GPs are currently experiencing high workloads and long wait times for appointments. Therefore, trying to follow up with them regarding medication shortages is becoming more difficult, with the patients being the ones who are being disadvantaged the most. If we were able to have some point of truth that was live and up to date, that would be a real bonus for these pharmacists and for the patients. He said current medication shortages that impact patients, and some may be WA-based, but amoxicillin, and patients are having to be switched to a different dosage, which means double the volume, decreased compliance with children, and also longer wait times while we call the prescriber to have the changes approved. That's what Rowan said. Exemptamide. He said the combination of product went out of stock, and that has seen the individual products now also go out of stock. He said we are then having to send patients back to their GP for a review as to what path to take with their treatment, which is taking more GP appointments that are currently hard to come by. He spoke of Duodart. It's been unavailable for almost 2 months and is used for benign prostatic hyperplasia. Not life-critical, but for many males can create social implications and fears when they're not able to obtain this. The individual drugs in this medication are not available on the PBS, so the pharmacist, as he said, we are unable to switch and the patients must go without treatment due to cost. Rowan then went on to say with Ozempic, this is a well-known shortage, however, has become easier, but again now has been put on restrictions from the wholesaler in which we're only able to order 1 pen per week to cover our 40 diabetic patients per month that are currently on the medication. The release of the new Wegovy is theoretically meant to ease the pressure on Ozempic. However, we do not see this occurring as the price of Wegovy is so much higher than Ozempic, so we still see patients wanting Ozempic over Wegovy. This is what's happening in regional Australia. He spoke about Vyvanse. This medication has had supply issues for the majority of 2024, and the complexity around seeking alternative treatments is extremely complicated as the medication is a Schedule 8 and prescribed through specialists who are often the most difficult to get in contact with in my southwest. Again, patients then having to go without medication, decreasing compliance. Also increasing significantly the workloads on pharmacy teams to manage these patients, stock supply, and be a middleman for communication between the specialist and the patient. He also spoke about Ordine liquid. The medication is often used for palliative care and is now discontinued. Shortages and discontinued. He then spoke of hormone replacement therapy. He said this is a continual issue in the industry and one that we see the highest rates of non-compliance due to unavailability of patients having to use products that are not effective because it is the best option available. He said ordering of stock is often also a logistic issue in regional areas, and we see a lack of understanding in this place for what actually happens in the regions. Rowan said, if we receive a prescription for a medication at 1:05 p.m. on a Friday, we're actually not able to have that medication delivered in store till the following Tuesday, as we are a regional area. No wonder people in the regions have a lesser health outcome. That is a 96-hour wait for a medication which, for me, said Rowan, is unacceptable. He's the pharmacist. To help our patient base, we choose to hold a higher stock on hand value, which comes at a cost to the business, cash flow, and for him as the owner, all to help us to service our community, something that metro businesses don't even have to think about. Also, being in WA, we experience higher number of stock outs and longer stock outs than other states within Australia. Another reason why we hold higher stock values, and I know that the wholesalers also hold higher stock values in WA. If a product is out of stock, particularly popular items, we may have to send that patient to Bunbury, which is an hour return trip when they are sick or unwell, to source a medication. That's in the southwest of WA. In our store in Dongra in WA, the same situation occurs, and we may need to send a patient on a 2-hour return trip for the same reason. These examples also add to the cost of living pressures, with patients then having to add the cost of fuel to sourcing medication, and being regional, those drives can be much further, of course, than in metro areas. This is the reality for those of us who live and work in regional Australia. It is not acceptable. This situation, as Rowan has said, is extremely common, and as much as we move mountains to ensure that our patients don't have to drive or wait 96 hours, more often than not, it has to occur. Rowan is the Pharmacist of the Year. He is an exceptional pharmacist. He goes above and beyond for what he provides to his patients and his people. Rowan went on to say, we also see that pharmacists acting in full scope in regional areas as a great solution to parts of this issue, as pharmacists would be authorised to make therapeutic substitutions. This would alleviate the pressure on pharmacy to contact the GP, patients having to wait for the GP to return a call, as often they cannot talk as they are in an appointment. GPs are very busy in regional areas, and the pharmacist would have full visibility of what is available at wholesalers. He went on to say medication misadventure is another issue that occurs, as often a drug might not be out of stock. However, stock might be extremely low, and each pharmacy is having to grab whichever brand it can find to ensure their patients will have continuity of supply. Now, they're the comments that I got from Rowan Lowe, who is, as I said, the Australian Pharmacist of the Year, who has a practice in Donnybrook in my electorate. Rowan went on to say, this is a daily issue, and we have to be very cautious, as we are always having to brand swap due to stock availability. And this drives confusion for the patient, and often a patient then takes 2 brands of the same medication. Often in WA, we are not completely out of stock, but we are frequently having to brand swap. So what this says to me is not only is this making the challenge for pharmacists in rural and regional Australia and the more remote parts more and more difficult, but it says to me that the government has a job to do in this space. To actually have those medications available for those pharmacists to be able to dispense when the GP actually writes out a prescription. Surely it's not too much to ask. And as we all know, the health outcomes for people in regional Australia, regional and more remote Australia, is far worse than what we see in cities. Surely this is one of the contributing factors. But unfortunately what we see here is not enough focus on rural and regional Australia and its needs compared to others as we see in the metro areas. Those health outcomes, this is a very practical example. And should anyone from the government or from the department want to talk to Rowan about what's happening for practical purposes on the ground, can I really encourage you to do so? It should be all of us in this place whose job it is to make sure that it shouldn't matter where you live in this country. Your postcode should not be the determinant of the health outcomes that you have access to and the medications that you have access to. But that's what we've got. Here's the evidence. And I'm calling on the government and anyone here from the department to take me up on this offer to talk to Rowan and perhaps some other rural and regional pharmacists, not people based in Canberra or based in a city. Why not talk to the pharmacists who have to live and work with this day in and day out? How do you think they feel when they cannot prescribe and actually hand over the counter, dispense what the local people need? And you need to remember, our pharmacists live and work with us as families. And when we walk in their door, they know our history, they know what we are predisposed to. We rely on them as part of, often, the only medical treatment. We're living with a lot of communities now because of changes that the government has made. We've seen a flight of GPs out of regional and remote areas. There's not GPs in every community like there were because the overseas trained doctors can now practice in out of metro.
Chasing the dollar.
That's exactly right. So we rely then on our pharmacists. Often, if there is a pharmacist in our community, they're the ones we rely on, but they need the medications to be able to dispense, irrespective of where that prescription comes from, wherever that GP is that prescribes. We need them to be able to access those medications. So, in my contribution to this, Deputy Speaker, I'd just like to finish by encouraging, I'm happy, and I know Rowan would be very happy to talk to anyone in the government or anyone from the department to give a practical view on what is actually happening to the pharmacists and the issue for the patients and our people in rural and regional Australia. I refuse to accept that it's okay for the people who live in rural and regional and more remote parts of Australia that they cannot have access to the medications they need compared to others. That is not okay by any standard.